So food allergy is when your body reacts with an antibody called an IgE antibody to a food that would otherwise not affect the normal population. And it can be anything from a skin rash to a throat closing to a condition called anaphylaxis, which is the life-threatening condition. But then it can also give you other conditions such as eczema. It can contribute to gastrointestinal problems. So it's a wide variety of conditions, but the main cause would be the food that you ingest. It's very interesting because you need a genetic ability to become allergic. So if you really ask, there's usually somebody in the family. Then you need exposure. Now the exposure happens to us by our normal ingestion of foods. There's a current new hypothesis that is involved that, especially in children around food allergies, is that there's a race between becoming tolerant, which means you're not allergic, and becoming allergic. So tolerance is obtained through the gut, so the food that we eat, whereas allergies, they have now hypothesized, are started through our skin. So children with eczema have a higher risk of becoming food allergic, whereas children without eczema have less of a risk. And that has fundamentally changed our approach to infant feeding. So we now know that there's a window of opportunity to introduce foods to babies, and that window starts between 4 and 6 months. And we then introduce all the foods, all the allergenic foods, which is completely different to the way I raised my children, which was avoid, avoid, avoid. We now know that food avoidance leads to allergies as well, which feels counterintuitive. So if we are talking pure IgE-mediated allergies in terms of your severe food allergies, the diagnosis of anaphylaxis is that it happens within 2 hours of ingestion. So that's a very clear, very hard line. We have one that is not included in that, and that is a red meat allergy, and that happens 6 hours later. And so, but in general, we say within 2 hours. The symptoms vary, so it could just be hives or a skin rash. It could be hives together with throat closing, your chest closing, diarrhea and vomiting. Those would be the symptoms and signs of an anaphylaxis. And if it carries on, then it can be life-threatening with your cardiovascular system. In other words, your blood pressure dropping so much that it could be fatal. That's the most severe form of the food allergy. Less severe forms would be what we call non-IgE. You do get very severe forms of non-IgE. In other words, we don't pick up these antibodies in the blood, but these patients, once the food is eliminated, they are much better. That would be in your esophagus, also in your gastrointestinal tract. So that would be children where food gets stuck in their esophagus, they can't swallow the food, severe vomiting, and in the case of a condition called FPIES, massive diarrhea and systemic collapse. You also then get the less severe form of that, which could be eczema, or your patients with irritable bowel symptoms sometimes could be allergy related. So the most common foods are egg, milk, fish, prawn, peanuts, and the later ones are sesame and a product called lupin, which seems to be an emerging allergen. These are also the foods that are on compulsory labeling. Sesame, unfortunately, in South Africa is not labeled, which can cause a very significant problem. Those are the most common food allergies, but you do find other foods that are extremely rare, but you find other foods. The red meat allergy definitely occurs later on in life, and it is linked to a tick bite. So it's a very interesting allergy that was recently discovered, and it's a specific protein that you become allergic to called alpha-gal. there is a small community in the Eastern Cape that they are busy studying that we do find that in. The first thing would be antihistamine, because that is something that most people would have in their little medicine cabinet and that you could have. There are really affordable over-the-counter antihistamines. If you chew it, it works faster than if you just ingest it. The next thing would be a similar situation. If you've had the reaction and your chest closes, you could buy an inhaler over the counter, which is also really affordable. If you are stuck at home at night, then I would say you have your antihistamines. I would suggest remove anything that you suspect might be causing the problem. Also, fresh air would help. But if the symptoms are really severe, one would need to find help. If you want to diagnose, you need to start at a healthcare practitioner that understands allergies and not be seduced by products and promises that aren't under the guidance of somebody that understands allergies. Because there are allergy tests offered that aren't endorsed by the Allergy Society of South Africa. They give you a list of 140 allergens, but it actually tests your tolerance and not your allergies. And those are very expensive, and patients are extremely discouraged when they've paid for these tests. They come to you and you basically tell them it's worthless. So rather investigate, and then find somebody. A good GP will be able to at least do the basic testing, so you don't need to find an allergy specialist, but to find your GP to go to that would be able to start the testing. The most cost-effective testing is skin testing above your blood tests, and it is just as accurate. So you don't need to go for the really expensive test. The skin test is an accurate way of finding out whether you have an allergy. The problem is the interpretation of your tests, and that comes back to you can't self-diagnose and self-treat, because you can have a positive test and not be allergic, just to confuse you.